have some time to actually dig into the literature, figure out what the important questions are, figure out what they want their contribution to the field to be. And I was really appreciative of having that time. And so a lot of what I focused on was the health of undocumented immigrants in particular. I'm going to share with you some of the results from that review, and then talk a little bit more about mental health in particular, which is something that I focus on in my own research, and tell you a little bit about an intervention that I'm currently testing for Latino women. And so I will talk about how migration influences the health of all Latinx populations, but we'll focus quite a bit on immigrants and undocumented immigrants in particular, as a group that's been particularly targeted and marginalized in our country. So just to give you kind of an overview of the Latinx population, we are still the largest and fastest growing racial ethnic minority in the United States and have seen a lot of growth over the last 2 decades. This was historically in large part due to increases in immigration. That immigration has now slowed, and most of the growth now is due to births. So children of the immigrants, 79% of Latinx are citizens and 33% are immigrants, and about 12% are undocumented. And undocumented meaning people that entered without legal permission to reside or work in the United States, or overstayed visas that they originally had when they entered. So this is about 11 million people in this country, and they're people that are likely to stay because immigration policies have made it so difficult to go back and forth between the U.S. and their countries of origin. So I think an important population to think about their health. And we know that many are staying long periods of time. 78% of Latinx immigrants have now lived in the U.S. 10 years or more. So I use the stages of migration framework to kind of think about how immigration influences health over the life course, or just through before they came to what their life is like in the United States. And I think this framework is helpful for thinking about immigrants, but it also is helpful for thinking about how the migration process might influence the children of immigrants, and even intergenerationally, how it might influence 3rd and 4th generation Latinos living in the United States. Because we all have people in our community that are immigrants and carry the historical experiences from previous generations. So we know that before migration, I'm going to walk through each of these stages, but just brief and kind of summarize the literature at each of these stages, but just briefly, we know that before immigration, when they're in their countries of origin, Latinos experience economic stress, political instability, and violence. During migration, they can experience dangerous physical conditions, exposure to violence and trauma, and also face the risk of detention. And then after migration, I'm going to focus on how 3 different factors, immigration policies, social networks, and discrimination, influence their health. So we know that migration is often driven by the lack of economic and educational opportunities in countries of origin, also often driven by political instability or war or violence, and it's important to think about how that context and trying to escape or flee from that context can influence their health before they even come to the United States. We know that exposure to all of those types of stressors is associated with poor mental health outcomes. We know that from research on various immigrant populations, not just Latinx. But in a few studies that actually I've done myself, we've shown that Latinx immigrants who have experienced poverty prior to coming to the U.S. or trauma have a higher risk of depressive symptoms and PTSD. And we know that those experiences in their country of origin also make them less likely to want to return to those countries of origin. So thinking about the context during migration, the U.S. policy in the last several years has really tried to prevent immigration through deterrence. And so there's been increased immigration enforcement along the border, which has redirected immigrants to more dangerous and remote areas if they're going to be crossing the U.S.-Mexico border. And so that has increased exposure to physical hazards, high temperatures. People often have limited access to food and water during that journey, and that has led to increased injuries and deaths. We also know that many Latinx immigrants have to hire guides to help them with that journey across and pay large sums of money, thousands of dollars, for those guides to help them, but they are often exploited by those guides as well. And so they often experience physical, verbal, or sexual violence during the migration journey from those guides or from other people that they might be traveling with. And this is a particularly precarious time for women, and many qualitative studies have shown that women migrating are particularly vulnerable to experiencing sexual violence. There's also, of course, increased risk of detention and deportation during this time and getting apprehended by Border Patrol. And we know through a lot of reports coming out by civil rights organizations and some research that being in detention is also not a healthy place to be. They can experience further abuse from immigration officials, lack of medical care, inhumane conditions, and this has also been a time where parents and children have been separated. Thinking now about what might happen after migration, we know that immigration policies can have both positive and negative effects on health. So some of the federal policies that we've seen recently have been increased deportations, a huge increase in funding for immigration enforcement, and this has been both on the border and in the interior. So an increased number of raids and decreased opportunities for asylum or higher criteria, more stringent criteria for visas that have made it more difficult to enter legally or to obtain citizenship after entering the United States. In terms of state level policies, there have been policies enacted in the last several years where documentation of immigration status is required, either by law enforcement, state or local law enforcement during stops, or some states like Alabama are having schools requiring immigration status for people trying to access, education system. And then there's been Secure Communities, a big program that has allowed state and local law enforcement to basically perform immigration enforcement activities, or check the fingerprints of people against immigration databases when they're doing local law enforcement. And so there have been studies that have looked at how this plays out in the health of the people in that state, and these studies have looked at the health of Latinos in general as well as the health of Latino immigrants. And we have seen worse mental health for Latinos in general, decreased self-rated health, decreased use of preventive health, prenatal care, and public health services in places where these policies exist or where we see increased immigration enforcement. And this is obviously particularly critical for undocumented immigrants, because that increased immigration enforcement is also leading to increased fear of deportation, more anxiety, and more social isolation, which then in turn leads to less access to services because people are afraid. So the next area I want to focus on after migration is how the immigration process disrupts social networks. And we know that social networks play a really important role in protecting the mental and physical health of Latinos. And so we've seen a separation of parents and children through different immigration policies, and that is associated with worse mental health for the parents. When the primary earner in a family leaves or is deported, then oftentimes a single parent is left behind with fewer material resources to care for their family. And we also have seen that there are worse child health outcomes for families that experience parent and child separation. So loss of appetite, poor sleeping, and behavioral problems in the kids, as you can imagine. So we also know that social support, again, is a really important buffer against those negative impact of immigration-related stressors, and so I think it's important to highlight that people are really drawing on these transnational relationships. So we've seen that a lot of Latina immigrants in particular talk about relationships that they maintain back home and how important those are on a day-to-day basis in terms of maintaining their mental health when they're in the United States. So finding ways to continue to communicate. A lot of people have left aging parents behind. I've actually come to the U.S. to earn more money to take care of the health issues of those parents, and then of course have to deal with being far away from them, but trying to maintain contact, and that contact can be really beneficial. And then we know for once they're in the United States that relationships between immigrants can be also very beneficial for exchanging information and resources. So finding other immigrant communities can be helpful. And then the last area I want to talk about in terms of what happens after migration is the experiences of discrimination. And so this can happen for Latinos based on their race, ethnicity, but also can happen based on their country of origin, whether they're immigrant or not, or based on being from a particular country, and it can happen based on their legal status. And so there's been quite a bit of literature, over many years documenting especially the negative effects of interpersonal discrimination in Latinos as well as in other racial ethnic groups. I would say there's been less focus on discrimination due to legal status or immigration and language is another area where we're starting to see more research happening. So we know that it's bad for their health, and this, I just think it's important to point out, in the same way that we see police violence towards Black communities, we see that similar violence by law and immigration enforcement towards Latinos, and particularly Latino men. And so the immigration enforcement is very much race and gendered. I think it's something like 75% of the Latinos in detention are Latino men, or 75% of the people in detention are Latino men. And so that mistreatment can happen in that way too. And then we've just seen a huge increase in anti-immigrant sentiment that has led to stereotyping of Latinos as foreigners, and the criminalization of what it means to be Latinx, that it's illegal to even be present here in the United States. And so we've seen reports of discrimination when Latinos are seeking housing, employment, and health care. And immigrants can be particularly vulnerable to this, so I think it's important to think about how this might vary across different regions in the United States, where in some places immigrants are more visible. They're more visible in places where there's not large Latino populations, right? So you're not in California or Texas, where you can fit in, but if you're in the Midwest or in the Southeast where there haven't been large Latino populations, and there's, especially in rural areas where there's not public transportation, so you have to be in your car, and that all of that sort of day-to-day living actually is putting you at risk of, interactions with other people that may be harmful to your health, but particularly interactions with law enforcement and immigration enforcement. So I just wanted to kind of show how this might play out for one particular health issue and sort of how we see risk factors along the different stages. So if you think about mental health in particular, you can think about how stressors that might be happening before migration, like being in economic stress, living in poverty, or experiencing gang violence in your country of origin, or witnessing violence towards other people, might already put you at risk for things like depression or anxiety or PTSD. And then you add on the exposure to violence and trauma that can happen during the migration journey, which would only further increase that risk. And then after migration, you might be dealing with fear of deportation. If you're an undocumented immigrant, you might be dealing with social isolation. If you've had some of those social networks disrupted, you might also be dealing with discrimination and economic stress, depending on the kinds of employment that is available to you. All of this coupled with a lack of access to mental health care and bilingual, bicultural providers. So we know that Latino immigrants are at particular risk for mental health problems. And so what we also tried to do in our review is highlight some promising strategies for how we might improve mental health. And we also focused on a few other health issues that I'm not going into today, but one of them was HIV, which I'm excited to hear more about from Jane Lee. And so when we looked at what some of the promising strategies are, we know that a lot of, first of all, we need to increase access to mental health care, and when that's not available or not sought, also trying to create community-based programs to reduce stress and risk for poor mental health. We know that a lot of immigrants in particular seek healthcare at community health centers, and community health centers are increasingly trying to integrate behavioral health with primary care, and that is a way to identify people that might be struggling with mental health issues in primary care and addressing the issues of stigma. We know that community health clinics are also using community health workers to provide screening and brief counseling and referral, and these are people that more represent the population, might be seen as safe ways to access services, or might be more receptive to services that are promoted through community health workers. Community-based programs can be helpful for, again, people that might be reluctant to seek care due to fear or stigma, and we know that programs that build on the existing social cohesion or the coping strategies that social support that women are already using, and men are already using in some cases too, that already exist in those Latino communities, can be helpful. And so I wanted to share with you, one program that I have been developing over the last 10 years and am currently testing in a R01 funded by the National Institutes of Minority Health and Health Disparities. And this is an intervention that's aimed at preventing and reducing depression and anxiety through two main mechanisms. One way is by increasing social ties and social cohesion among Latina immigrants. We know that that can be beneficial. And the other way is by trying to reduce stress, reduce stigma around seeking mental health care, and increasing coping strategies that they might already be using, and introducing them to new coping strategies that they might not have been exposed to before. And so we do this in an 8-week class that we offer in the community, and I've been working with Casa Latina and El Centro de la Raza here in Seattle to offer this class. And we provide food, we provide childcare, we introduce women to things like yoga and mindfulness approaches that they might not have been exposed to, but again, we just provide time for them to come together. Usually the groups are about 20, and oftentimes, they're building new social connections through spending time with other women. And we have some practices. We have kind of a set of core practices that we teach one each week, and we have some beautiful art. This is Alma. This is a centering practice that we teach that helps women sort of find their inherent dignity and think about the people that have come before them, the future generations that are going to come after them, and really center themselves to really, maintain their resilience in the face of these stressors. I just wanted to close with some of the recommendations that we made after our review about future research. Since this is mostly a research audience, we do have some recommendations for practice, which I can share during our panel conversation as well. But in terms of theoretical and conceptual considerations, I think this field can really benefit from more life course and intersectional approaches. We have yet to really look at how these patterns vary by age, stage, gender, sexual orientation, so we need to put the work further in that direction. We need to do more interdisciplinary work, which is why meetings like this are great, and really, I think in order to identify the structural solutions that we're going to need to address some of the negative effects of immigration policies, we're going to need to draw on the fields of law, philosophy, history, sociology, in addition to public health. And, as I mentioned, these transnational frameworks that help us think about how people are living lives in two countries at the same time can help us understand changes to social networks and family structure. In terms of some more methodological recommendations, we need to start naming legal status in our studies. We've been really reluctant, I think, to collect that information, and I think in order to really understand the effects of immigration policies, we're going to have to do better at that, and I think it can be done in an ethical and thoughtful way, and so that's part of what I want to encourage researchers in this field to do, that if you use community engaged research approaches, you can make participation in research feel safe and feel meaningful to these communities. We obviously need to ensure the security of the data and confidentiality, but I think it's also important to give people the opportunity to self-disclose their legal status if they want to. And I think it's also important to just explain the research process, and that's part of doing anti-racist research too, is really letting the community be part of the research and establishing the research questions in the first place, but also having them understand the value of their participation. And my experience has been that people really do value the opportunity to share their experiences and don't often get a chance to hear their voices heard, have their voices heard. So I just wanted to close by thanking in particular the two collaborators that I worked with on this review, Nina Yamanis, who's at American University, and Raymond Ruiz, who's a doctoral student here at UW. Some of the funding that I received for this work, both internally here at the University of Washington, having the time and space to work on this was really important. But also the RON that funded the ALMA project, the community partners that I worked with and continue to work with, and then the wonderful collaborative ALMA team. So thank you.
I did forget to mention that we will hold questions to the end. I think all the panelists, all the discussions will flow very nicely. So next we will hear from Jane Lee. Jane is an assistant professor in the School of Social.
Hello everyone, thank you so much. I'm so glad to be here. And my presentation will really tie well with India's presentation, and I'm so honored to present after her. She's been a great mentor to me, so thank you. So I'm going to focus my presentation on stigma and its influence on health among Latinx immigrants. And by providing a framework on stigma and how it intersects with other identities, I hope to get us thinking about potential strategies to truly integrate and address stigma among this population. And specifically, I'll apply this framework to HIV/AIDS prevention, which is the focus area of my research program, and specifically among Latinx immigrant men who have sex with men. So stigma is a powerful force, and extensive research has demonstrated that it greatly influences determinants of health, and it's also often considered a social determinant of health as well. So through the process of stigmatization, people with minority identities can be targeted, labeled, stereotyped, and marginalized, and oftentimes by groups with more social power. And this process can lead to status loss, discrimination, and victimization. And as a result, it can have a detrimental effect on health at a variety of levels, including access to health, health-seeking behaviors, and also have implications for negative mental and physical health outcomes. So while there's been a great deal of research on stigma and its effects on health outcomes, the research on intersectional stigma, as India mentioned, has developed much more recently. Specifically, there has tended to be research that has examined unidimensional stigma, or stigma that's assumed to originate from just one target identity or issue such as race or ethnicity. But assuming that stigma is unidimensional doesn't really account for the complex ways in which social identities interact to produce multiple layers of stigma. And it doesn't integrate how stigma can also be compounded based on different minority statuses such as race, ethnicity, gender, age, etc. So intersectional theory emerged as a phenomenon across different academic disciplines, and it really highlights the complex ways in which social identities can produce multiple interconnecting layers of stigma, And it illustrates that these multiple identities are not and should not be considered independently. So given that when we think about ourselves, we often don't just think about one aspect of ourselves, rather we think about the various intersections of our social locations and how they're very interdependent. And that can mutually and simultaneously shape our outcomes and experiences. So this is particularly important for immigrants as they're a diverse group that often belong to multiple minority and stigmatized groups, which can really increase their vulnerability to experiencing distinct disadvantages. So to relate this specifically to HIV/AIDS, we know that the influence of stigma and HIV has been widely researched, and stigma has been acknowledged as a significant factor that can shape HIV risk and prevention behaviors. So we know that HIV prevention services such as testing or pre-exposure prophylaxis or engaging in safe-sex behaviors are really critical for preventing new HIV infections. But stigma, particularly stigma associated with being HIV positive or having HIV, can trigger negative attitudes, stereotypes, and fear about what that means. So in order to enhance HIV prevention, not only do services need to be available, but people need to access them, they need to utilize them, and in many cases, they need to adhere to that treatment or behavior. But stigma can impact each of those aspects of prevention and behaviors, and specifically stigma associated with HIV at the structural and individual level can pose a major barrier to prevention. For example, it can manifest as prejudice, stereotypes, judgments, which can lead to social exclusion, discrimination, and as a result of those experiences, people can experience shame, fear, and then ultimately mistrust of the system. So when thinking about stigma associated with different identities and stigma associated with HIV/AIDS, we can see that there are many different types of stigma that an individual can experience. And as an example, when we think about Latinx immigrants in the US, we can see that there are several factors or identities that can contribute to stigma and shape their subsequent experiences. And it's not solely stigma linked to HIV/AIDS. For Latinx immigrants, they can be of several minority or marginalized identities. This figure isn't exhaustive, but for example, race, ethnicity, which can be often linked to language barriers, sexuality or sexual orientation for folks who identify as gay or bisexual or who don't identify as gay or bisexual but still engage in same-sex behaviors. We also know that Latinx immigrants tend to have lower incomes or be parts of lower socioeconomic status groups, which can have implications for education or employment. And finally, immigrant status, which can really shape access to healthcare, social services, have legal implications, and lead to a type of visibility or invisibility given the current socio-political climate that can really have a detrimental effect on health-related behaviors. So immigrant status in particular, which India discussed, it has been stigmatized in recent years, particularly with the current socio-political climate. And as we all know, with greater focus on immigration and immigration policy in the news and other media outlets, it's really heightened this attention on immigrant status. And when thinking about this population and barriers to accessing services, a major component that often comes up, not just in the literature, but in actual discussions with the community, is a sense of concern and fear about the current political climate, specifically related to immigrant status. Even for those who might not identify or who might not be undocumented, the rhetoric and debates about immigrants in general have tended to affect all those who identify as foreign-born or immigrants. And we see that this identity is associated with health disparities. Specifically, when looking at HIV/AIDS in King County, we see that migrants are a neglected and high-risk group. So to provide some epi background, 21% of residents in King County are foreign-born, yet foreign-born individuals account for 32% of all new HIV diagnoses in 2017. And we see that the diagnosis incidence was also 2.7 times higher among Latinx immigrants compared to their US foreign counterparts. And when also thinking about HIV prevention services, such as testing and PrEP, we see disparities as well. So HIV testing is the first step in linking folks to care. And in King County, 29% of foreign-born individuals were diagnosed late, compared to 16% of US-born Latinx individuals. And while current estimates of pre-exposure prophylaxis, or PrEP, which is a medication that can be taken to prevent HIV infection, are similar among Latinx individuals and groups of other racial and ethnic groups. Latinx folks